para malusog kayo ni baby. Remember mga nanay, breastfeeding malaking bagay. Ito'y ipagpatuloy kahit na over 2 years old. Tamang nutrisyon, don't forget, yan ang tamang solusyon. I like it, lucky one, oh, oh, oh. Yan ang tamang paraan, tamang nutrisyon, don't forget, yan ang tamang solusyon. I like it, lucky one, oh, oh, oh. Yan ang tamang paraan, ang iyong little girl or boy, sustansya'y dapat puno. Susi sa tamang paglaki, go grow food na handa mo. First 1,000 days importante, healthy eating para kampante. Paghandaan nutrition ni baby, makinig sa sinasabi. Tamang nutrisyon, yan ang tamang solusyon. I like it, lucky one, oh, oh, oh. Yan ang tamang paraan, tamang nutrisyon. Yan ang tamang solusyon. I like it, lucky one, oh, oh, oh. Yan ang tamang paraan, lucky one, oh, oh, oh. Yan ang tamang paraan.
Nasa tiyan mo pa lang ako, alagang-alaga mo na ako. Kung ano ang kinakain mo, yun din ang kinakain ko. Mga nanay, kain kayo ng mabuti ah! Habang pinagbubuntis mo ako, lahat ng kailangan ko, binibigay mo. Ang iron at folic acid supplement ay para sa maayos na paglaki ko at iwas anemia mo. Mga nanay, para po sa inyo ni baby to! Nung nasa tiyan mo pa po ako, lagi na tayong nagpapatimbang sa health center. Dapat may dagdag tayo na halos 1 kilo kada buwan. Senyalis ito na tama ang nutrition mo. Mga nanay, dapat tama po ang timbang nyo. Pag pumupunta kami ni nanay sa health center, lagi ninyo kaming tinutulungan. Binibigyan ninyo ng payo si nanay tungkol sa pagpapabreastfeed sa akin. At kung ano ang masusustansyang pagkain na kailangan ko. Salamat po sa inyo! Buti na lang po, nandyan kayo!
Ang babing hindi na breastfeed, maaaring madalas magkadayariya na pwede niyang ikamatay pag napabayaan. Iba paggatas ng ina ang pagkain ni baby. Lumalaki siyang malusog at malakas ang resistensya. Kahit nasa trabaho si mommy, pwede pa rin siyang mangolekta ng gatas. Sa breastfeeding, madaling bumalik ang kalusugan at pangangatawan ni mommy. Suportahan ang breastfeeding para malakas si baby, kampante si mommy, pati na si daddy.
Gatas lamang ng ina ang ibigay kay baby sa unang 6 na buwan.
Para mas healthy ang mga babies nyo, dapat alagaan sila ng tama. Importante ang nutrisyon nila sa first 1,000 days, mula sa pagbubuntis ni mami hanggang sa pangalawang taon ni baby. Dapat masustansyang pagkain. Kailangan din magpa-check up ni mami buwan-buwan para sa diabetes, anemia, at iba pang sakit. Breastfeeding is still best for babies, mula sa panganganak hanggang sa pangalawang taon ni baby. Masustansya ito sa bata. Sa tamang nutrisyon, lalaki ng healthy si baby, like daddy.
Nay, bakit kahit nasa trabaho ka, may breast milk pa rin akong naiinom dito sa bahay? Kaya pala ito ang ginagawa mo. Pinag-iipon mo ako ng breast milk habang nandun ka. Tapos, iniiwan mo rito para kahit umalis ka na, hindi ako magugutom. Pati pagkain meron. Kaya mula nung maliit pa ako, Hanggang ngayon, walang problema. Galing mo talaga, Nay! Sa araw, kahit anong oras ako magutom, umaga, tanghali, nandyan ka lagi, Nay. Kung ano ang kailangan kong kainin, inihahanda mo. Kapag gabi na at akala ko'y tulog ka na, konting iyak ko lang, gising agad. Napakasarap sa pakiramdam ng yakap mo. Idol kita, Nanay. Kahit nasa trabaho si Nanay at si Tatay, hindi ako nalulungkot. Hindi rin ako nagugutom kasi kasama kita, Lola. Bago umalis si Nanay para magtrabaho, nagiiwan muna siya ng breast milk niya para maibigay mo sa akin, Lola, pag nagutom ako. Pati pagkain may nakahanda na rin. Minsan nga ikaw rin po ang nagluluto para sa akin. At syempre, naglalaro rin tayo. Lola, bukas po ulit, ha? Nandito ka na, Lola! Sobrang enjoy ko kasama, Lola! Lagi mong tinutulungan si Nanay mag-alaga sa akin. Lalo na kapag nagbe-breastfeed ako kay Nanay, ikaw po ang nag-aayos ng mga gamit ko. Hinahandaan mo din ako ng mga pagkain na masustansya. Yan ang lola ko! Tay, hindi ka nawawalan ng ginagawa? Naglilinis ng bahay, naghahanda ng agahan, at kung ano-ano pa. Pag nagbe-breastfeed ako kay Nanay, ginagawa mo lahat para tulungan kami. Nakikita ko nga si Nanay na laging nakangiti at masaya. Idol kita, Tatay! Nung 1 month pa lang ako, si Nanay ang madalas kong kabonding dahil breastfed ako. Pero ngayon, dahil mas malaki na ako, palagi na rin kitang nakakasama, Tatay. Tinutulungan mo po si Nanay maghanda ng pagkain ko. Ikaw na rin minsan ang nagpapakain sa akin. Mas masaya pag maraming bonding time kasama ka, Tay. Mas masaya pag sama-sama tayo. Tay, hindi kita masyadong nakikita sa gabi. Siguro nasa trabaho ka. O baka naman hindi pa inaantok. Pero minsan nung nagutom ako, habang karga-karga ako ni Nanay, bigla kitang narinig sa kusina. Yun pala, inihahanda mo ang pagkain ko para sa susunod na araw. Tay, tulog na po ako. Nay, ngayong 6 months na ako, araw-araw mo akong binibigyan ng pagkain habang patuloy ang pagpapabreastfeed mo sa akin. Pero minsan, hindi mo alam kung ano pa ang ihahanda mo sa akin. Kaya pumupunta tayo sa health center para magpaturo ng paghanda ng complementary food na pwede mong gawin. Ang dami nilang itinuro sa atin. Ang healthy ng luto nyo, Nay! Ang sarap ng pagkain ko ngayon! Gulay sa lugaw! At sabi mo, Nay, mabuti ito para sa akin. Iba't ibang pagkain nga ang hinahanda mo para sa akin. Pakukuluan mo muna, tapos dudurugin. At ihahalo sa malapot na lugaw. Nay, bukas po, gulay ulit ha?
It's not true. Hindi lang para sa mga hirap sa buhay yan.
Yung nabubuong bond, priceless.
Hindi siya sakitin. Cute nga eh.
It's the best source of nutrition para kay baby.
Sinunod ni Doc yung wish ko, yung unang yakap. When I held him, naiyak ako.
Wala talagang tatalo sa breast milk. Join us. Breastfeed your baby.
The best pa rin ang nutrisyon galing sa nanay.
Magandang umaga sa ating lahat. Ikinagagalak namin na kayo ay kasama namin sa pagdiriwang ng National Breastfeeding Awareness Month ngayong Agosto. Bago tayo magsimula, nais naming magbigay ng ilang paalala upang maging maganda ang talakayan ngayong umagang ito. Aming ipinapaalala na ang webinar na ito ay nakarecord. Kung kayo man ay hindi sang-ayon sa recording ng session na ito, ipaalam ang inyong saloobin sa mga organizer o maaaring sumali na lamang sa mga susunod na session. Inyo pong mapapansin na bilang participant, ang inyong audio at video ay naka-off. Ito ay para maging tuloy-tuloy ang ating session. Ang inyong mga katanungan ay maaaring ilagay sa Q&A panel kung kayo ay nasa Zoom session o sa chat box kung kayo ay nanonood o nakikinig sa Facebook live stream. Ang inyong mga katanungan ay sasagutin sa question and answer portion ng ating session ngayong umaga. At sana ay huwag po kayong mag-atubiling ibahagi ang inyong mga katanungan. Ang mga certificate of participation ay ihahain sa mga sasagot na evaluation form at ang link sa evaluation form ay ibibigay kapag patapos na ang session. Maging sa Zoom man kayo nakatutok o sa ating Facebook live stream. Para naman sa mga kasamahan natin sa session na nanonood bilang isang grupo, nais namin ipaalala ang pagsunod sa mga minimum health standards upang maiwasan ang paglaganap ng COVID. 4 ang ating binabantayan upang maiwasang magkasakit ngayong pandemya. Una, ang lugar kung saan tayo ay nanonood at nakikinig sa session na ito ay dapat na may malayang air circulation. Pangalawa, physical distancing ay kailangang patuparin. Siguraduhin na 1 metro ang layo mula sa isa't isa. Pangatlo, siguraduhin na ang bawat isa ay may suot na face mask at face shield. At pang-apat, 30 minutes lamang na magtagal sa isang lugar ng pagtitipon. At panghuli, unawain natin na iba't iba ang ating access sa internet. Maaari tayo ay maka-experience ng lag o delays dahil sa paiba-ibang lakas o bilis ng ginagamit nating internet service at ito ay kinakailangan ng ating pasensya. Muli, Happy National Breastfeeding Awareness Month at sana ay makasama pa namin kayo sa iba't ibang virtual sessions tungkol sa kalusugan at nutrisyon para sa ating mga kababaihan at mga bata. Nagagalak kaming tayo-tayo ay magkakasama sa advokasiyang ito.
Pag-ampo. O Diyos sa katawhan o katilingban, daghan kaayong salamat sa imong gihatag kanamo nga higayon sa pagpulong karong adlaw. Nang hinaot nga imo kaming giyahan og lamdagan ang tagsa-tagsa kapanghuna-huna ug lig-uno ng among kasing-kasing aron matagaan og tubag ang among mga pangutana. Hinaot nga mahimong kalamdagan sa kamatuoran, taliwala sa among mga pagduha-duha ang mga kaalam nga among makuha karong adlaw aron among makabot ang saktong pagbuhat sa among katungdanan, isip o sa kakatawhan sa katilingban. Nang hinaot nga tagaan minimo sa kabaskog, dili lang sa among panglawas, ingon man ang kaisog nga ipadayag ang kaayuhan sa katawhan. Himua kami nga imong instrumento para mugiya sa among pamilya, sa among isig kaingon, ug sa tibuok katilingban para among makabot ang malambuon, baskog ug malipayong komunidad. Among igasa kanimo o Dios ang pagpulong karong adlaw para sa mga nagpadayon nga nakigbisog ug naningkamot sumpuon ang among giatubang nga krisis sa COVID-19. Ingon man ang mga nakasinati og kapait ug kalisdanan tungod nga nahilayo sa ilang tagsa-tagsa ka pamilya ug sa mga apektado niining sakit nga mitaliwan na sa kalibutan. Diyos nga maluluyon, naninguha kami sa maayong kinabuhi, ilabi na sa mga inahan, bata ug kabatan-onan. Nang hinaot kami nga makatabang ug makatabang ang usag-usa kanamo. Amen.
Good morning. My name is Aya Escobar from the Family Health Division of the Disease Prevention and Control Bureau of the Department of Health. We are glad to have you with us in celebration of August as the National Breastfeeding Awareness Month. For those who were not able to register for the Zoom session, we are live streamed in the DOH Healthy Pilipinas Facebook page and the Facebook pages of the National Nutrition Council in the first 1,000 Days Philippines. Thank you to our Centers for Health Development, the Ministry of Health in Bangsamoro Autonomous Region of Muslim Mindanao, regional offices of the National Nutrition Council, and partners who have joined us today. This session is made possible by the support of the World Health Organization, the United Nations Children's Fund, the Korean Embassy, the Korea International Cooperation Agency, and most especially the National Nutrition Council. Our session for this morning is for local government units and health facilities. By the way, this is the last of the 2 technical sessions for this month. These technical sessions were developed with health workers, health facilities, and local government units in mind to raise major issues that affect the care of mothers and children during this pandemic, especially when it affects infant and young child feeding. These technical sessions, this technical session for the day was already preceded by another one last Thursday, which was on how to build human milk banking. But today's topic is a focused discussion on COVID-19 algorithms for the care of mothers and children during this pandemic. And the goal is to clarify service delivery algorithms to guide protocols and procedures for care of mothers and children. So for our first speaker, we have with us Dr. Romile Camiling Alfonso, and she has been one of our most enduring partners for maternal and child health. Dr. Camiling Alfonso loves to convene people to co-create solutions that strengthen institutions and systems as a whole. She finds her motivation for health equity rooted in her experience as a doctor to the barrio and a new mother who experienced gaps in healthcare. Her decade-long work as an independent consultant spans scale-up implementation, strategic planning, health systems research, advocacy, and multi-sectoral collaboration. Since the start of the pandemic, she has co-convened multiple working groups as part of the Healthcare Professionals Alliance Against COVID-19, or what we see as HPAC. She is part of the steering committee, and one of them being the Unified Algorithms Working Group. She is also currently board secretary of the Alliance for Improving Health Outcomes, founding member of the Philippine Society of Public Health Physicians, and also a consultant for Kalusugan na Mag-ina. Doc Lay has a master's in public health, focusing on health systems management and policy from the Institute of Tropical Medicine in Antwerp, Belgium. She did this on full scholarship, and she is a University of the Philippines College of Medicine alumna. We are very happy that Doc Lay is here with us. But before we go to her topic, we will be briefed on the misalignment of global COVID-19 breastfeeding and newborn care guidelines with World Health Organization recommendations. With us is Dr. Paul Andrew Zambrano, Regional Technical Advisor for Alive and Thrive Southeast Asia. Doc Paul is a medical doctor and public health nutrition specialist, and with a decade of experience in maternal and child nutrition, humanitarian coordination, and management of acute malnutrition. At Alive and Thrive, Doc Paul provides technical support to strengthen the policy, environment, and breastfeeding-friendly health systems and social behavior change strategies in the ASEAN, as well as managing the global e-learning project of Alive and Thrive. Before Alive and Thrive, by the way, Doc Paul worked with UNICEF Philippines and Myanmar, Save the Children, and the World Health Organization. He obtained his medical degree from the University of the Philippines, Manila, and earned a master's degree in nutrition for global health from the London School of Hygiene and Tropical Medicine. Okay, so we will have 2 topics today, and this will be started off by Dr. Zambrano. And Doc Paul, we can begin the discussion now. You now have the floor.
Thank you, Aya. Good morning, everyone. Just give me a few seconds to load my slides. Okay na ba? Nakaload na.
Yes, Doc Paul. Kitang-kita
Okay.
naman.
Alright. Okay, so magandang araw po sa ating lahat. Ako po si Dr. Paul Zambrano. Kung naka-attend po kayo ng last technical session, nandoon din po ako. So welcome back. And to the rest, thank you for taking time to join us this morning. Good morning also to my co-panelists and to Lei, who's my batchmate in medical school. The highlight of our technical session is, of course, the Philippine guidelines, the Philippine algorithm. But I want to give a background on what's going on in the other parts of the world that are related to the guidelines on maternal and newborn, obstetric and newborn care in the context of COVID-19, particularly how these guidelines evolved over time and what that means for breastfeeding. So there's a bit of good news, but also a lot of things that we should be worried about, all of us working in public health. Okay, so just a very quick conflict of interest declaration. I have no conflict of interest to declare. So I won't speak too much about our work in Alive and Thrive, but just to say we focus on maternal and child health in different parts of the world, and we do focus on practices that can be implemented at scale. So as a background, I'll be presenting the results of a study that we conducted earlier this year. But the background of that study is really that the key issue at hand is that what we do know right now, and I think this is the basis or the pillars of the Philippine algorithm as well, is we do know that the risk posed by COVID-19 must be weighed against the protection of breastfeeding, separating mothers suspected or confirmed infected with SARS-CoV-2, which is the virus causing COVID-19, from the uninfected is a key preventive strategy, generally speaking, but mothers and babies, as we know, are a special case. Separation is not associated with reduced transmission compared with keeping mothers and babies together and supporting breastfeeding when appropriate infection prevention and control measures are followed. And we know that the risk of COVID-19 infection in infants is low and infection is typically mild or asymptomatic. So the benefits of separation and early breastfeeding outweigh the risks of COVID-19. And that's the reason why WHO maintained their recommendation that mothers with COVID-19 should be supported to breastfeed. Mothers and babies should not be separated unless the mother is too sick to care for the baby. And if separation is done, appropriate psychological or psychosocial support should be in place. And when a mother cannot breastfeed, the hierarchy of feeding options should be followed. Expressed breast milk, donor milk, and wet nursing should be the primary options before artificial feeding options like breast milk substitutes are even considered. So our study wanted to investigate and to see whether the different guidelines in the different countries were aligned with the WHO recommendations on breastfeeding and non-separation. So we reviewed 33 country guideline documents distributed as you see there. Most are in Asia region and quite a number from high income countries. So this is not just for low to middle income countries like the Philippines. So these are guidelines available as on the dates 21 March to 30 April 2020. So just to say that this is a snapshot of guidelines at this time in the pandemic, and not that does not reflect updates to the guidelines that may have happened between 30 April and today. So the practices we looked at are skin-to-skin contact, early initiation of breastfeeding, rooming in, direct breastfeeding, alternate feeding methods as listed in the slide, as well as what psychological support for mothers and infants were included in the guidelines. So what were the results of our study? We saw that less than 1/3 of the guidelines recommended skin-to-skin contact and early initiation of breastfeeding. I think there's no need to look at the figures and all these numbers, but just to say that despite the recommendations that are already available at the time from WHO, less than 1/3 actually gave that recommendation. Okay, and then many guidelines. As you can see in the graph, it's maraming numbers, no? But basically, quite a number still recommended isolation, no? or recommended, or in some cases recommended that newborns may be with their mothers in the same room but still separated within the room. So there were a lot of variations in how the guidelines um, worded the recommendation. So even in countries where there was a donor human milk bank, most guidelines still did not mention donor human milk if breastfeeding was not possible. And even fewer mentioned donor human milk banks. Like I said, even in countries na merong human milk bank, hindi siya nasama sa recommendation. And very few of the 33 had some or worded a recommendation on psychological support for infants and mothers. 82% of the guidance we reviewed did not mention any support at all, and 94% did not mention support for infants. So the previous one was for mothers. So we know that in the early phase of the pandemic, these institutions, the China Expert Consensus Group, US CDC, American College of Obstetrics and Gynecology, the Royal College, and WHO all released guidance very early on, but they were medyo iba-iba yung sinasabi nila with regards to skin-to-skin and breastfeeding. So because of this, there were and country guidance, including Philippines, we were basing our guidance on what these institutions recommended. So as a result, we saw that conflicting guidance within the same document sometimes happens. So kunwari, isang guidelines, pero sa isang part ng document, magkaiba sa sinasabi nung latter part. No? And then there were some recommendations that did not seem to have an evidence base, such as the use of face shields for newborns, dun sa nasa picture. And we also saw that even across these agencies, there were differing guidelines. And sometimes within a country, a different guidelines is issued by the Nutrition Authority or Nutrition Agency, and the Health Agency and the Pediatric or Obstetric Professional Society or Association. So what now? What did we learn from assessing all these guidelines? So we saw that no guidance document that we reviewed at that time followed all of WHO's recommendations. So none of the guidance we reviewed that recommended separation had any provision for psychosocial support, and we should be concerned with this because this is alarming and cannot be justified by infection control risk. The physical distancing of mothers and infants and lack of breastfeeding, as we know, reduces maternal caregiving capacity and is associated with poor developmental and psychological outcomes. So we saw that expressed breast milk was commonly recommended, but donor human milk through human milk banks less so, and no country guidance recommended wet nursing in the period that we reviewed them. So non-evidence-based guidance, gaps and conflicts that we saw in this period present a barrier to provision of appropriate care. And guidance that's not evidence-based can actually cause harm. And we saw, and findings from other studies suggest that some guidance, because of the need to issue things quickly, dahil mabilis nag-evolve yung pandemic, they were developed with limited evidence and was of variable, low methodological rigor. Ibig sabihin, hindi siya as solid as we would want an evidence-based to be for a guideline to be issued. And then the communication of the guidelines is also not very clear. So may konting confusion pagdating sa healthcare providers natin. And this is just a slide showing that the different guidance evolved over time. I think the one that evolved most is the RCOG guidance, and I think it's now mostly, if not fully aligned with the WHO recommendations. Okay, so preventing skin-to-skin contact has had a devastating impact, or can have a devastating impact on breastfeeding and maternal well-being. So ito na yung relevance nito sa breastfeeding, since there are other risks associated with it, but we want to ground it on breastfeeding practices as well. So we know that no skin to skin and no rooming in and no breastfeeding substantially reduces the probability of mothers actually exclusively breastfeeding. So in our study, 29% of separate. So in other studies show that up to almost 30% of separated mothers who tried to breastfeed were unable to or had difficulty with breastfeeding, and almost 60% of mothers who were separated from their infants were very distressed. And again, separation and we would say having guidelines that are mostly based on fear of transmission more than the evidence and the facts. They undervalue the importance of breastfeeding. So those developing guidelines during the pandemic and in future infectious disease outbreaks need to appropriately consider the importance of skin-to-skin contact, early initiation of breastfeeding, and rooming in. So there is a strong evidence base for maintaining these recommendations. So the limitations of our study there were a few. So we didn't. So some of the guidelines we evaluated were published prior to the release of the updated WHO guidance. So they are likely updated by now, and we did not assess how these guidelines have changed. And this is the link for those who want to read the paper. And this is not part of our study, but I just want to highlight that there is a life-safe tool to assess the excess mortality that are associated with certain practices. So our colleagues from WHO and other colleagues published this in the Lancet. No? So in their estimate that infants, if separated from mothers with confirmed or suspected COVID-19, do not breastfeed, it could lead to 188,000 to 273,000 infant deaths. Whereas if you assume that 10% of mothers had COVID-19 and 30% infected their infant with a mortality rate of 0.09% from COVID-19, it will only be around 2,800 infant deaths. So it's nearly 100 times more number of deaths due to separation than due to the virus. And if you apply this same tool for kangaroo mother care, then we see a similarly spectacular difference where we see a 65 to 630 times increase in deaths with withdrawal of kangaroo mother care. So I'm almost at the end, but just to say that we are doing a reanalysis of guidelines. Instead of 33 countries, it's now going to be for more than 100 countries collected at a later period in the pandemic. So these are the more updated guidelines. But we do note that for those who already have started reviewing, there are still policies for separation of healthy infants that are in place in some of the countries. So let me end by saying a quick thank you sa lahat ng health worker at lahat ng kawani ng gobyerno na tumutulong at sumusuporta sa ating mga nanay at ating mga baby ngayong pandemya. These are the members of the study team and some of the references. So on behalf of Alive and Thrive, maraming salamat po. Over to you, Aya.
Maraming salamat po, Dr. Zambrano. And para doon sa ating mga magtatanong later kung maaari ba kaming makakuha ng mga materials na ito, definitely we will be providing po the links through our Centers for Health Development. Again, thank you, Dr. Zambrano. And now for our second speaker, may I call on Doc Lay, Dr. Romelay Camiling Alfonso, to also share with us the unified algorithms for the care of mothers and children during the pandemic. Hello, Doc Lay.
Good morning. Maraming salamat po for having me here. I'm so happy to also be here with Dr. Paul Zambrano. Yes, he's my classmate, and it's very good na contextualize po yung i-discuss natin ngayon for our setting, that knowing that the challenges we are facing as health workers in terms of providing service for mothers and babies, hindi po tayo nag-iisa. Globally, this has happened. Hopefully po, this session will provide clarity in terms of the guidance and the policies that are in place for our country. Please wait for my screen. I hope it's already showing right now.
Yes, Doc Lay.
Thank you. So let me begin by saying good morning to everyone. Alam ko po, marami sa inyo baka mahina yung internet. Don't worry, we will be providing a copy of this. And not only that, you have access also to the live website of the guidance I'll be talking about. So again, I'm Lay and I have different hats. Marami po akong pwedeng i-represent, but for now, I'll be speaking on behalf of the Healthcare Professionals Alliance Against COVID. And in the process, touch on the algorithms that are for maternal and child health as part of the larger body of algorithms for clinical guidance in COVID-19. So declarations, again, I have no conflict of interest to declare. I have the following affiliations. The maternal and child health algorithms were developed pro bono by experts and facilitators without funding support, and the living CPGs under which right now the algorithms are part of are funded by the DOH AHEAD program through the DOST PCHRT. So maybe our objectives for today is to identify challenges. Many of these have already been discussed by Dr. Paul, and then describe the policies that are relevant to these key challenges in our setting in the country, and introduce the unified algorithms. And as an example, we will take on the MCH algos. So the highlights of this is the shared decision-making between healthcare professionals, women and their families, and our low-resource settings. And just to put context, at the beginning of the pandemic, based on a rapid survey of maternal and newborn health professionals, like many of you, they've expressed lack of practical guidance on how to deal with patients. And only 1 out of 3 received training on COVID from their health facility. And the disparity is worse when it comes to low and middle income countries like ours. And ito po, no, when you have no guidance in an uncertain situation, nakaka-cause po yan ng stress. And in fact, this was also reported by our healthcare professionals serving mothers and children. And there was also an alarming decline in the use of and access of services. And I believe many of you have also experienced this, because women are afraid to come to the healthcare facilities. They are afraid of being infected. And I'm sure this is again happening given the surge. And healthcare providers are able to unreach the workplaces. And because of this, konti lang po yung mga nanay na naaabot. Mabuti na lang kung meron tayong telemedicine, telephone communication tools, and hopefully by now you're able to set them in place. So at the end of the day, there's also a compromise on the quality of care. As discussed already by Dr. Paul, there are changes in policies and practice that are knee-jerk, not evidence-based, like the following: not allowing birth companions, separating newborns, and induced labor and cesarean section rates. And many of these would have long-term and short-term consequences for our mothers and baby. Looking at the big picture, kita natin ang hirap mong balansehin ng COVID response, especially at the onset. So we have now our health system wherein we need to respond to the demands, uncertainties, maintain lahat ng mga basic services natin, lalo na sa RHU, and of course, prevent the health system from collapsing. While on the other hand, tao rin po tayo. Tao tayo, healthcare providers, we want to ensure our personal health and well-being, while at the same time providing quality patient care. Mahirap din dito when we talk about the mothers and the babies. They're not typically the sick population. Wala po silang sakit, no? They come to you ideally in a happy moment na manganganak sila. They waited for this for 9 months. And yet, because of this pandemic, naiipit sila. So what do we do? Again, it's fear, it's knee-jerk reaction, separating the mothers and the babies. In the Philippines, ito po, nakabunga dito sa mga news at nakakalungkot po that many moms choose to give birth at home, and at the worst case, namamatayan po tayo. Sana po walang nangyari sa inyo ng ganito, and these are the things exactly that we want to prevent. And when we talk about care, quality care, we have to put in center also or discuss patient-centered care. So when we talk of patient-centered care, ilagay mo yung sarili mo sa posisyon ng pasyente. Diba, that's what we normally do. Pag marami na tayong trabaho, pag minsan we need to dissociate. But then at the same time, being compassionate, ang hirap na yan pag maraming work, no? And I think it's an effort for us to continue putting these principles in caring for our patients, and hopefully the algorithms will show you later and guide you on how this is framed. So when we talk of patient-centered care, it is providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide clinical decisions. And pag po mothers and babies ang pinag-uusapan natin, hindi lang yung mother, yung baby, diba? Dalawa. We have the mother and the baby. And at the end of the day, whatever happens to the mother and baby, the whole family is actually affected. So we talk about women or family-centered care when it comes to mothers and babies. Again, reiterating that the mother-baby dyad is one unit. Package deal po yan sila, buy one, take one. No? And this requires coordination and negotiation among multiple decision makers and actors. Buti siguro kung sa line-in, actually it's more straightforward pag po ang nagpapaanak ay midwife, dahil isa lang po, naaalala natin yung 4 core steps of unang yakap, and at the end of the day, yun po, those things are more within our control as individual practitioners if you are a midwife listening now. But if you are a doctor and you're working with a team, then this also means a lot of coordination. And again, normative, when we talk about mother-baby diet as a healthy unit, first embrace, again, reiterating, it's a set of 4 simple evidence-based and cost-effective steps that benefit all newborns, including those that are sick preterm born by cesarean section. And now, the question now, will this still hold for the pandemic? And I believe many of the discussions have already been presented by Dr. Paul. I'll go back again to the norm, which is, we have seen this, it is a solid, it has been established that delaying breastfeeding even by just an hour already increases the risk of infection-related death. Alalahanin po natin, when we talk of breastfeeding, it's not just about nutrition. Okay? When we talk of breastfeeding, it's about that colostrum na binabalutan po yung bibig, yung bituka, yung tiyan ng sanggol, binabalutan siya ng mga antibodies to protect the baby from any intruder, no? Mga mikrobyo na maaring maka-cause ng infection. And that's why that is the first vaccine. The first breastfeeding is the first vaccine. Also, if we look at the benefit of skin-to-skin contact, I know many of you are familiar with this. If you just increase the the length of time, even by just an hour, you're already doubling the odds for exclusive breastfeeding success. Okay, so hindi mo pa nga kinounsel yan, wala ka pang ibang ginawa, hinayaan mo lang magdikit balat sa balat yung nanay at baby, then this already increases the odds for exclusive breastfeeding. And the question here now is, if this has been the norm, what is then the impact of a 14-day separation? And for those of you who have already counseled mothers and babies who have been separated in families, we know, no, iyakan po yan. And we know at the onset, talagang yung mga mother support groups, they rose, they stepped up. And they have been providing a lot of remote support. They've been sharing a lot of milk. And the impact of this 14-day separation is really heartbreaking. And therefore, we really need to weigh out the risk versus benefits. And as healthcare professionals, our first consideration is we do no harm. So at that time, even up to now, this is still hold that there's no evidence to support that early separation improves outcome, particularly for getting the virus. So separation, it creates different concerns that may compromise the mother and baby. alam ko po, kayo, nag-iisip kayo, operational, no? Ibig sabihin, ano gagawin ko? Paano ko gagawin yan? Pag hiniwalay ang mother and baby, twice the burden. Kasi, dalawang sets pa. Sino magbabantay sa baby? Pag magbabantay sa baby, kailangan titignan mo rin, papascreening mo pa rin ba yun? Paano kung yung mismong mag-aalaga sa baby or yung dadatnan ng baby sa bahay, meron ding infection. So we do not know. We need to have protective equipment for the caregiver of both the mother and the separated baby. And even at home, kailangan nakaseparate siya. And when this was also presented to the stakeholders, particularly the mothers from the 4Ps, the low income families, and they understood the implication of this. And these are pregnant women. They said, Doktora, napakahirap po niyan kung paghihiwalayan kami. Hindi ko po alam kung sino ang magbabantay sa anak ko. And instantly, they knew that this is something that is very hard to implement. Okay, so these were at the onset, and nalaman naman, and we know that our colleagues from the UN agencies also at the early on, they released the statement. And the idea here is we have to put unang yakap again as the norm. We have it in place, and we have to keep it in place even though there is a COVID pandemic, with proper IPCs or infection prevention and control interventions. May trivia po dito. When we were also helping the DOH and the different stakeholders develop the clinical practice guidelines, we had a front row seat because one of our colleagues, Dr. Mian Silvestre, was also part of the guideline development group of WHO at the Geneva level for COVID-19. And so we were getting first-hand information on how the policies will be shaping, and therefore we were confident in the direction that we are taking in terms of evidence. All right, so again, that time, daming nagtatanong po, no, whenever the maternal and child health guidance was raised, even in this, I'm not sure, nakita niyo po to, many of you may have been part of this, no? Noon, ang sipag-sipag pa. These were all volunteers trying to answer guidance, practical guidance for frontliners, especially on the ground, private doctors and doctors in the public sector. This was very active and hot topic po yung maternal and child health lagi. Okay. So that time, again, the knee-jerk reaction was to come up March 30 with the policy, and the highlights of this is that all moms were suspect cases until proven otherwise, and then separate the baby temporarily until COVID results are both negative, and if testing was not done, separate until 14 days. But that's the beauty also, because the policy is evolving quickly as the evidence comes in. Okay? So that was the knee-jerk reaction. We really had to hurry because of the 142,000 Filipinos that are born every month, it's estimated that almost half are born in community-based health facilities. And we know that the previous policy really centered on the testing capacity and also a very hospital po yung approach, no? And we need to take care of this 45% who are born in community-based facilities. So I'm just flashing that because the PSPHP at that time was also helping by facilitating a process wherein the MCH algorithms were tagged as priority algorithms because of frontliner and patient feedback. And there is a need to contextualize for primary care settings. And in a way, what we did as a methodology was to scope policies locally, internationally, get best practices and articles, key informant reviews from relevant stakeholders, especially po, pati sa mga nanay, lalo na sa low-income groups. No? And the feedback was synthesized also with the help of the volunteers from the Viber support group, and drafting and it's a stakeholder review, etc., etc. So at the end of the day po, all of these were also discussed in the Unified Algorithms Technical Working Group. And by July 13, this policy has been released, wherein the interim guidance repealed the initial issuance. Okay? So ito na po yung bago. So what are the features of this? So ito po yung nakakabit. If you've seen that policy, you've downloaded it in the DOH website. So later, I will connect that now to the updates. But what were the features? Features introduce boxes. I will introduce this later and go to the live site with you. So boxes 8 to 9 is the referral, and then the birth planning as emphasis, and then case classification, you have shared decision making and linkage to other algorithms. If you go to the detail of this, you see that there is no bottleneck for RT-PCR, and the testing status of the mother will not affect the quality of care. Okay. And again, it's about the interlinkage and the default on evidence-based practices, which is unang yakap. And again, emphasis on the shared decision-making for boxes 7 and 10, temporize RT-PCR for the dyad after the routine care, okay? And linkage to other algorithms. So the features, bottom line, these are the guiding principles. We need to make the right thing, the easy thing for maternal and child health guidance. So simplified flow and format, evidence-based guidance as default, and there is opt-out. Okay, it's not like you lump everything like ito na siya, yun na yun, final na. There is opt-out that is possible. And then we also de-emphasize RT-PCR. Testing does not change clinical management in the immediate care. And then the results should not come in the way of sound clinical judgment. Unang yakap as a default, and there's clear guidance in decision-making. Okay, I'm going to segue now. So far what I discussed is that there was knee-jerk reaction across the world, Philippines not exempted, and then we had policies, and there was an evolution in the policy, initially separation, and now the July policy put back the evidence and updated it with the normative, which is unang yakap, okay, and non-separation. Okay, so the segue now is coming to the unified algorithm. So you have here different logos from the different medical societies that came together very, very quickly we joined forces. This is the largest gathering of healthcare professionals. Because the idea here is if we all unite as healthcare professionals, then if we are united in our front, then we can better serve each other given the uncertainty, the confusion, and at the same time we can have a stronger voice when we talk about the things that need to be in place for the pandemic response. And lastly, if we are together and are aligned, united in front, then we will benefit the patients because there's less confusion when it comes to practices. So again, the Healthcare Professionals Alliance Against COVID, or HPAC, we have been working together. These are people who have come in as volunteers, and the three targets we have, target audiences, would be public policy people. The people in public policy, we want clarity and alignment. So if there is something that is not aligned with evidence, then we speak up. Hindi lang po masyado nagpapa-interview, but we are there. And then we also want to help our colleagues by putting together standards of health, no? Parang united tayo, pare-pareho tayo. And lastly, we want to target the general public for behavior change communication. But mostly the work we've done is on number 1 and a lot on number 2. Okay. So what we saw is that COVID was an eye-opener. We cannot exist in our bubbles. And there was an intersection of public health, clinical medicine, other healthcare professionals, not just doctors. No, you have midwives there, pharmaceutical, pharmacists, and you have different healthcare professionals. And we have the involvement also of other sectors. You may check us out in this link. And there's a Facebook page also. Okay, so connecting that now, this is part of PISMID, but many of the people working here also are part of the HPAC steering. So you have COVID, wherein evidence quickly evolves, and what we see as an opportunity is that technology facilitates quick response. So maybe particularly for the algorithms when they were being developed, there was a lot of discussion only on Viber groups. No, you cannot imagine this happening in a non-pandemic setting wherein ka-text po ninyo, mga presidente ng societies or people who are really very busy, but they really, with their generosity, would respond to because of the urgency of the situation and the need on the ground. So, clinical practice guidelines improve the quality of care. Why? Because they help in task-shifting decision-making. So kung wari komplikado yung decision, yun po, magbibigay na siya ng clarity dun sa proseso ng pag-decide, no? And when we think of this, we don't need to go through all of the evidence that they have already gone through. And when I say they, the consensus panel and the people who have been doing this, facilitating this, also make sure that the perspectives of the different stakeholders are taken into consideration. So there's already systematic review of evidence, assessment of benefits and harms of alternative care options. So ano ba ang mas matimbang, titingnan natin, and then reducing inappropriate variation in practice and ensuring efficient use of limited resources. Okay, I hope you're still with me. We're going now to the live in a bit, no? So here po, ito yung idea. Kung meron kang evidence and then magkakasama kayo na uupo, gawa ng guideline, yung expo dyan, yun yung tools mo, no, na kumbaga, they reflect the evidence, the tools, the algorithms reflect the guidelines, and you disseminate, have your practitioners provide feedback at the same time, the patients also, and all of these things can provide a feedback loop in the updating. Okay, so ito po yun hindi basta-basta gagawa lang ng kung ito yung gusto, ito yung mangyayari. No, there is that group who looks at the evidence and the context and provides a consensus before actually putting those in place. This is the policy cover of the clinical practice guidelines. Okay, this was March 31, and the highlight here is that the CPG on COVID by PISMID shall be used in the clinical management of COVID-19 cases in all hospitals. Okay, and this should be subject to update by the society. If you look at here, even this covers all, and I believe we can have share a copy of this DM later. Now, the idea here is how do we disseminate? So one of the ways to disseminate during the 50th anniversary of PISMID, PCP, this was also disseminated. And then we also disseminate it through the website. And the website now, you can access it in your computer or in your mobile phone. So the living CPG, subsumed under it would be unified algorithms. We recently came up with the update last June 21, and in 10 days po, it was able to gather 21,000 views in just 10 days. Okay, so always when you come in, there is a disclaimer. And disclaimer is it's being updated. It's based on current literature, best available evidence. Okay, for the algorithms, so the guiding principles we tried to stick with in the development is it should be evidence informed, so it reflects also the living CPGs. It's patient centered and equitable. As mentioned, benefits and harms are considered, and takes the lens also of the patient family, particularly in underserved areas. So it's context-driven in terms of feasibility. Paano kung dun sa bundok mo walang RT-PCR, syempre? So how do you do that? And it's responsive. And that's why we've had 4 updates already. All of these things, labor of love, wala pong bayad, wala pong kinikilingan, walang conflict of interest. Okay? So here, the beauty of the algorithms, so there are different sections there. If you might see later, this is the previous version, but we also have guidelines on return to work, wherein it uses standard format. If you have had the training on Unang Yakap, yun din po yung format. So many of you are already familiar with the format of the algorithms. Napakasimple lang po niya. Mukha lang siyang nakakatakot sa umpisa, but if you go through it, it's very doable. Madali po siyang maintindihan at diretso lang po yung kanyang format. Interlinked din siya. So itong return to work na to, pwedeng mag-connect siya sa testing. Pwede siyang mag-connect sa how do you reintegrate, no? Or connected din po yung management of mild COVID sa clearance. So may interconnection po siya at aligned po lahat. Okay? So, yan. How to use it? Yan. So you read from left to right, and then the shapes have their meaning. So yung shape po, yung oval is a clinical state. And by the way, even if you do not remember this, it's okay, no? But just to let you know, may ibig pong sabihin yung shape. Pagka yan ay, ano ba to, octagon ba to? May yes or no. So it's a decision box, and you have an action box. So the action box, you don't need to make any decision there. You just need to carry it out. And then the connection box, okay? So I'm going now to the live website. I hope it works. If not, I'm going to use the PDF. So again, when you go to the website, you will see this disclaimer. So I hope you're seeing yung PISMID. I'm going to provide the link also later. So you click that and you're led to this. Medyo mabagal po yung internet kung hindi naglo-load yung mga logos. So if you would click here, so this is the PISMID website, and you can click here on the COVID-19. You have the algorithms right there. And you have here the living recommendations, the CPGs, okay? So if I click on the living algorithms, so it goes to this page, and then, so updated last, and then you have, okay, I'm gonna show you. You have the background developed by, and et cetera, et cetera. Here, what's important here, you have the download. Dati po wala yung feature na yan. You can already download it here. And we provide kung kailan siya na-update. So we also announce pagka meron na pong bagong update through the Medical Society page sa main thread, so that everyone, the updates will be cascaded. Here you have, if you click that, it will download the PDF version, so you don't need to always log in. Alam po namin mahina yung internet sa maraming areas. Okay, so this is the format, the navigation table. So you can click it and it leads to the instructions. For example, figure 1, how to use it. Ito po yung pinakita ko sa inyo kanina. And then after you read it, you can return, click to the navigation. And then you have here the different algorithms. Okay, let's go through them. Like asymptomatic patients. Okay, patient presents to you, asymptomatic siya, pero meron siyang hawak-hawak na test, no? So this can also cover now your APORs and clearance, di ba? Yung mga, wala naman silang symptoms. Nagpa-test lang sila nung gagawin mo sa kanila. And then COVID close contacts, mild cases, moderate, severe, and critical. So it spans across primary health care to hospital care. Okay? And then you have other algorithms. So nandun po tayo sa other. Yan, other siya. So you have emergency department transport and the pregnancy, labor, and newborn. Okay? So the use of PPE is also here. Very important. Advanced care planning, end-of-life planning, postmortem care guidelines. This is not yet an algorithm, it's just a guideline. Okay? So now if you click halimbawa po, no, I'll go to, so let me just go up. I hope you can see it po, no? Is it visible, or do I need to increase the screen?
It's visible, Doc Lay.
All right, thank you. Okay, so here, for example, wait, let me just navigate a bit so you can see the entire thing. Okay, there you go. So dalawa po siya. You can navigate it here for your mismong screen. Dito, you can navigate it here for the actual document. But you don't need to do that because you can click it here, okay? So now, here you have testing and triage. Here you have management and discharge and reintegration. Let's take, for example, the mild, and I click mild, triage and testing. Okay, sana mag-work. Go internet. Okay, so halimbawa po, you have now the mild, triage, and evaluation. You start with the clinical state. Okay, so a mild suspect comes to you. Meron yung footnote, at dun sa footnote, nakalagay anong ibig sabihin ng suspect. Okay, I'm not going to the details. These are things you already know, but hopefully we're all aligned so you can check it out, okay po, and review. Ito ba yung ginagawa namin sa LGU, okay? So, and then you have now a box, meaning to say it's a decision box. You only need to do it. So isolate, and facilitate testing. Isolate the patient, facilitate testing. Hindi mo siya i-isolate pagka dumating na yung test results. Huli na yon. And then, inform the close contacts. Oh, maghintay na tayo ng test, ha? Yeah. So, ganun po siya. Inform close contacts. So, again, meron na namang footnote yun. Surprise yan pag binasa po niyo. Basahin po natin mamaya. And then, ang question na next is the RT-PCR available? Kung yes, then you do the RT-PCR. Kung no, in a symptomatic patient, so you do the rapid antigen test. And kung meron, do it. Okay? Positive, if you note, pag positive siya, tutuloy siya ngayon sa another clinical state, which is your mild confirmed. Ba? Dali lang po. And then, paano kung wala pareho? Wala kaming testing, nasa bundok ako. So, pupunta ka ngayon sa next question, sa no. Is the patient previous contact or linked to a cluster of cases? Again, meron siyang definitions here. If yes, then ito, tatanungin niya ulit to kasi ano siya, highly suspicious to. So kung meron na, by this time, you do it, and kung mag-positive siya, confirm, di ba? And then ito rin, recent anosmia, if hindi po siya required, so if chest imaging was done, suggestive of COVID. So you have a high suspicion across 8, 9, 10. Again, there are boxes. So box 8, box 9, box 10, meron kang high index of suspicion. So kung hindi siya, lahat wala, so you have a non-COVID case. Okay. But if mag-yes yan, and then wala kang RT-PCR pa rin, ang classification mo sa kanya ay mild probable. Okay po? And then it connects now to your contact tracing ensured at the CESU-MESU level, and it will now connect to the mild management. Okay? Dali lang po, no? So I'm going quicker here. So you come with from a patient who was a mild suspect that was triage and ending up with a mild probable or confirmed. Again, the key actions that need to be done paulit-ulit pag minsan para hindi mamimiss. So ensure that contact tracing has been initiated through the BIRD, CESU, MESU employer. Bakit may employer? Pag minsan po kasi no, sa company, doctors sila pupunta or pag minsan din pupunta sa inyo, but you need to also inform the employers kasi paano kung nasa factory siya, so kailangan malaman ng employer, no? And then, so ang tanong po dito, saan mo siya dadalahin, no? Here, available separate room in the household with proper ventilation. Kung yes, ang next mo na question, so may separate na kwarto, proper ventilation, can you, as a healthcare provider, adequately monitor and treat the patient's evolution at home? Kung yes, does the patient prefer to stay at home? Kung yes lahat yan, then you can isolate at home. Test case dito. Kung wari number 4, nasa mansyon yung iyong pasyente, bakit mo pa siya ilalagay sa isolation facility ng LGU? Sayang naman, kaya naman doon sa bahay niya. Basta po, yun, they're properly instructed. So here you also have a lot of footnotes here. You can check on the other guidance for the footnotes. And if there is a no here, then you isolate at the TTMF in your Ligtas COVID Center, in your isolation facility for the LGU. So if you look at this, including here, ito po yung patient-centered instead. Kasi some patients may not prefer to stay at home because they're afraid mahawaan ko yung magulang ko. So they would rather stay in another facility. And then here, important number 9, quarantine the entire household, no matter what, even if at home or... So I hope you're getting the flavor of the algorithms, and I hope you can access them on your own. So let's go to the MCH, to the maternal... So yun po, no? And then just to give quickly the discharge and reintegration, ang important dito, may return to work, no further tests needed. Okay? So kung wari sasabihin kayo ni Mayor, gusto ko papatest lahat, or ng company owner, papatest lahat, sayang po yun. So based on evidence, ito po yung mga guidelines, and then you can give also the DM, and these are the recommendations based on the guidelines. So we can reduce the variability across the local governments. I'll return to the navigation, okay? And here we'll go to the pregnancy. So here po, ayan. Actually, if you go through it on your own, no, it's easier than me going with you through it. So here, you have a pregnant woman, whether in labor or not in labor, you counsel on infection control. And all of this, blanket po yan, not just on COVID suspects, but all patients, okay? So if the patient has signs and symptoms, and if the patient has indications for admission, you can look at the footnotes, then you classify them as such, mild, moderate, severe, or critical, and then refer, transfer. But if you're at the local government and there is no indication for admission, then the mild pregnant patient comes in here. And then if the patient has no signs and symptoms of COVID, pero dumating siya sa'yo, wala lang, gusto niya magpa-test or nagpa-test siya, no, na-ask siya to be tested, and then kung positive, then you have an asymptomatic confirmed patient, okay? And then ang tanong din ngayon, wala naman siyang test, wala siyang symptoms, you ask, is there an exposure to a known case? So ganon, close contact siya. So you have now the different clinical states wherein the pregnant patient can come to you. Okay? The next, and then, ayan, meron pa dito, at kung wala na ang COVID siya. So, baka naman taga Batanes siya, di ba? So, hindi naman lahat po. Titingnan natin yung konteksto. Okay? So, nandito yun. Considered siya dyan. Okay. Quickly po, if from number 9, and then from boxes 6, 8, 10, ito yung mga nakikita natin sa RHU or sa local government unit. Tanungin mo if there are any risks. So kung ganon, syempre, akyat mo ulit yan. Kung wala namang risk, tatanungin mo, is the woman about to give birth? Syempre, kung manganganak na, pupunta ka na sa labor. Kung wala, baka prenatal lang yun, di ba? Sana, huwag na kayo mag face-to-face kung kaya naman. Modified antenatal care and birth planning in the context of COVID-19. Again, you have a footnote here, letter I, for example, antenatal care. I'll go to this a bit small, but here you can see, consider modifications to protocols depending on quarantine level, including telehealth, reducing number of clinic visits, etc. And then you can also discuss here vaccination, feeding options, and birth planning, okay, and complication readiness, etc., etc. Okay? So nandun po yung reminders, hindi na ho niyo kailangan, nakalista na po siya doon. Now, if we're going to manage this pregnant patient na nanganganak, we click that, we go back to the navigation table and press H2. Okay, nanganganak na siya. The woman is about to give birth, okay? Pero ano siya? Either suspect, probable, or confirmed. Close contact. So you have to, again, blanket coverage, implement IPCs, and then, is the patient on imminent delivery? If in imminent delivery, syempre, admit. Active labor, yes. Bakit tinatanong pa to? Kasi yung iba, sabihin nila, ay hindi naman kami COVID facility. Kaya lang kahit hindi ka COVID facility, paano kung imminent labor na, diba? What do you do? So all of us should be prepared already should any mother come in with suspect case, and kahit hindi po tayo, diba? Ang hirap naman kung mamatayan or manganak siya sa daan. So we have to be prepared. Okay, so number 7, that's it. It's a box. Admit to a designated area. Require all attendants to wear appropriate PPE, and you have here a box that connects to the appropriate PPE for healthcare workers. So here, so assuming like you have time also to discuss the benefits of skin-to-skin contact and non-separation. Remember, this is time sensitive. The moment the mother opts out before siya manganak, yun po, mahirapan na tayong mag-discuss. But here, the emphasis here is on skin-to-skin contact, and normally their concern is transmission. So you have here some spills or guide on how you can explain to the mother. It's on letter B. So for example, the normative benefits of your skin-to-skin, and then here you also have like new evidence on antibodies found in breast milk, and also here I believe we have to also update here that here you have a footnote here at the very top which says that WHO recognizes that the recommendation of an infected mother to be in close contact with her baby may appear to contradict other IPC measures. However, the balance of risk is significantly different from infants and adults. the risk of infection of COVID for infants is low, typically mild and asymptomatic, and the consequences of not breastfeeding or separation can be significant. Why do we need to put this? No, we will need to be able to explain this to the mother for her and the family to come up with a real informed choice. When we say informed choice, hindi po yung parang nabuyo natin siya into saying, hiwalay na lang yung baby. Kasi kung hiwalay mo ng baby, babalik na yun dyan. Kung titingnan mo yung sa algorithm, discuss the feasibility of alternate caregiving if the mother chooses this. Because pag naghiwalay mo nga, pero pagdating naman sa bahay, magkasama din ulit. So in a way, that is counterproductive, right? So babalik ka ngayon sa letter C, which is yung footnote. Puntahan natin. Halagay dito, alternate caregivers for newborns, COVID infection risk is low, and it's typically mild asymptomatic, but should the mother prefer separation, alternate caregiving includes all possible contacts, including tayo po bilang health workers, family members, and perhaps even the other patients doon. Kung wari, iwala yung baby, di ba? And then discuss with the family who the available alternate caregiver will be for the next 14 days, what is their COVID status, and how much PPEs are needed, and blah, blah. Yan. Ito po, etc., etc. Okay? So, I think nandun po yung guidance. And I'm wrapping up right now. Of course, kung mahiwalay siya, yes pa rin dyan, discuss infant feeding options. And yun po. And the mother chooses, pag po gumawa ng choice yung mother, klaro po sa kanya yung benefits and risks. And if the mother agrees to be with the newborn, which is the normative question, hindi yung mother wants to be separated from the newborn. So here the mother agrees to be with the newborn, and we follow the 4 core steps. If still not, no, deliver the baby, dry immediately, clamp and cut the cord between 1 to 3 minutes. So we still give the benefit of the delayed or properly timed cord clamping. And what is skipped here is the skin-to-skin contact. Okay? And then here, important at number 18, if the mother desires at any point, she and her newborn should be enabled to remain together with proper IPC measures. Okay? So yun po, yung newborn also reflects that algorithm. It's very similar. And what is important here po is counsel on exclusive breastfeeding with IPCs. So that's box 9. And the box 9 here has a footnote on letter F, which is here, counseling on EBF, how to do that. And lastly, yun po, for that mother who has alternate feeding option, as discussed also by Dr. Poy earlier, you have the alternate feeding options hierarchy in here. Okay, I think that's the bulk of the maternal and child health algorithms. And just to wrap up, the key message of my technical session right now is healthcare workers need practical guides for COVID response. This allows for safety and efficacy of service, no? So that we can balance quality of care, personal safety. CPGs improve quality of care because hindi na tayo magre-review. The review is done by a panel for consensus, and the context is considered, and the CPGs are reflected in algorithms. No? There's clarity in decision making. There is self-efficacy and efficiency kasi nandun siya, klaro siya. The unified algorithms help ensure that practices are evidence-based and patient-centered, context-driven. I think that's the session. Maraming salamat po. I'm acknowledging the HPAC steering committee for this, also Kalusugan ng Mag-ina for helping facilitate also the consultations earlier on, and the mothers who also were included in the feedback for this algorithm. Thank you so much. Over.
Maraming salamat po, Doc Lay. So nakita natin na mula kanina sa unang presentation mula kay Dr. Zambrano, na sa buong mundo maaga pa lang sa pagputok ng pandemya, nagtrabaho na ang mga medical professionals na makakuha ng mga ebidensya para matuloy ang pangangalaga ng mga kababaihan at mga baby sa gitna ng pandemya ng COVID-19, lalo na para sa nutrisyon, psychosocial status ni nanay at baby, at psychosocial development ni baby. Lalo pat ang unang 1,000 days ng kanyang buhay ay ang pinaka-profound o ang pinakamahalagang stage ng kanyang development ng pangangatawan at ng kanyang utak. Malinaw ang ebidensya na tuloy pa din ang unang yakap at breastfeeding kahit na may COVID-19, pero kailangan lang ng precautionary measures o yung mga nabanggit ni Dr. Zambrano at Dr. Alfonso na infection prevention measures sa pangangalaga ng mga nanay at ng mga pasyente. So, ang galing naman sa naging lecture ni Doc Lay ay ang layon ng ang HPAC ay ang clarity at alignment o ang kalinawan at pagkakaisa ng mga protocol para sa service delivery ngayong mga panahon na ito. So dapat na tuloy-tuloy ang paggawa at pag-update ng policy at service standards for clear decision and efficient service delivery to provide care for mothers and children, at lalong-lalo na ang behavior change communication, hindi lamang sa mga health workers, kundi kasama na rin ng local government units natin, pati para sa ating mga pamilyang Pilipino. So, ngayon, binubuksan ko na po ang question and answer portion natin. Doc Lay and Doc Paul, if you can join me. Meron na po tayong mga questions na pumapasok sa ating Q&A panel, pero unang-una lang po muna parang refresher or parang mga unang tanong, parang pinaka-base questions natin. So, given these guidelines, para po sa inyong dalawa itong tanong na ito. So, given these guidelines, bilang rank and file na health worker gaya ng iba sa mga nakikinig sa atin ngayon, ano sa tingin ninyo ang maaari nilang maging role sa kanilang organization, sa kanilang mga facility, para masiguradong masunod itong mga protocols at algorithms na napagkasundoan ng napakaraming mga health professional organizations? Yun yung unang tanong, and meron siyang mga sub na tanong para lang magkaroon ng konteksto yung ating mga sagot. Mayroon bang mga halimbawa ng reforma ng service delivery sa gitna ng pandemya sa mga facilities na to? Alinsunod sa mga nauna o kasalukuyang version ng algorithm?
Sorry, I didn't catch the last statement. Pwede pa ulit.
So, mayroon bang mga halimbawa ng reforma ng service delivery sa gitna ng pandemya? Alinsunod sa mga nauna or kasalukuyang version ng mga algorithms natin? Kahit sino po sa inyo ay maaring mauna. If you want, mukhang ready ka na, Doc Lay. Gusto niyo po bang mauna?
Pwede naman, Dr. Paul, okay lang naman. Dr. Paul, baka gusto mo mauna?
Okay, sige. Yung unang tanong, ano yung role ng ating frontline health worker? I think the term used is rank and file, but I try not to use that term kasi sa akin lahat ng health worker, sa akin pantay-pantay yung role niyan, regardless of whether you are a specialist or a frontline health worker or a barangay health worker even, no? So I think part ng role natin, kasi system na health system, no? Hindi ko siya sasagutin na ano ba yung role, pero isang napaka-importanting bagay dyan is kailangan maging kumpiyansa tayo na yung mga recommendation na nasa guidelines ngayon ng HPAC at yung recommendations ng WHO, napakasolido po at napakaganda po ng ebidensya na sumusuporta doon. Kaya yung pong ang isang magiging role natin is siguro sa abot na makakaya natin, intindihin natin kung gaano o at least tanggapin natin o makipag-dialogo tayo para mas maintindihan natin na napakaganda ng ebidensya na sumusuporta sa mga rekomendasyon natin. Hindi po ito hinugot sa hangin. Kahit po nung simula, meron pong mga hindi lahat ng guidelines na pinagbasihan natin ng simula naging maganda. Kasi nga hindi pa natin completely na naiintindihan yung sakit ng panahon na yun. Pero ngayon po napakaganda na po ng ebidensya at malinaw po na yung mga recommendations sa breastfeeding, skin to skin, pagtuloy ng unang yakap, wala po diyang, lahat po yan nagtuturo na tama po ang ating rekomendasyon. So kapag tayo po nakikipag-usap sa mga nanay, nakikipag-usap po sa mga buntis o yung mga malapit ng mga anak, nakikita po nila sa inyo kung kumpiyansa kayo dun sa recommendation na yun. At malilipat na yung kumpiyansa sa kanila. So pag nakita nila na yung ano niyo, yung conviction niyo na talagang nanay ito po yung pinakatamang gawin. Naiintindihan ko po na natatakot kayo dahil sa sakit, pero parang ito po yung tinitimbang natin, yung pagpigil ng breastfeeding at skin to skin, ito po yung mangyayari. Mas magrabe po yun kaysa doon sa risk na meron doon sa COVID-19. So ipaintindi po natin sa mga nanay yun at ilipat po natin yung confidence natin sa kanila. Pero hindi po mangyayari yun kung tayo po mismo walang confidence. At dadating lang po yun sa atin kung naiintindihan po natin kung gaano kaganda po talaga yung evidence na nagsusupport sa atin.
Yeah, thank you, Doc Paul. Doc Lay?
Ganda po nung sinabi ni Dr. Paul about yung kumpiyansa. No? Kasi mga nanay, kung ano yung sasabihin natin, talagang sa atin sila umaasa din sa mga panahon na ganito. At sana po makatulong sa inyo yung algorithms. No? So ano yung gagawin? Download nyo po yung algorithm. No? At baka pwede kayong mag-umpu. Siyempre may physical distancing, dapat well-ventilated yung room. I-discuss po ninyo, no? At try yung isipin. Ano ba yung nangyari doon sa pasyente? Tingnan natin kung anong dapat natin ginawa, anong dapat natin gagawin pag ganito. So I believe malaking tulong po yun kung kayo mismo magkakaroon kayo ng diskusyon kung kaya via Zoom. For the municipal health officers here, I believe there's a lot of pressure maybe from other stakeholders in the local government to do other things. Hindi ko na po sasabihin kung anong LGU yung mga yan, alam naman natin. But perhaps this is also where we can use the policy to end the process that was explained earlier, like yung DM, and then nandiyan yung, ang dami-dami po talagang nag-isip na nito, sinuyod ang ebidensya at talagang inupuan po ito para pagdating po sa inyo, hindi na kayong gagawa ng kung ano-anong ano yung sinasabi ng kung sino man. These are things that have already been discussed. So if you can advocate for this sa local government po ninyo at magbigay ng guidance, maganda po yun. The other layer siguro, Ms. Aya, na pwede natin i-raise is sa DOH regional offices po. Kasi maganda rin po na dahil kayo din yung tinitingala ng ating mga local government. Alam ko nung MHO ako, tinatanong ko palagi black and white, di ba? So yun po ang kagandahan po nito. Meron po tayong cover for this, and our door reps can also disseminate this across the municipalities and cities. But going back to our frontliners, balikan po ninyo yung algorithms, try nyo pong tignan at kaya nyo po yan na maunawaan. Kung may feedback kayo, pwede rin kayong mag-comment dun sa page. So siguro yun lang po yung tips on how to improve the uptake. Over.
Okay, so kumpiyansa sa algorithms, kailangan ito at dapat kumpiyansa rin sa sarili. Ang algorithms ay talagang napakaraming ebidensya na nagba-back up sa kanya at hindi magiging kumpiyansa sa atin ang ating mga kliyente, ang mga pasyente kung tayo mismo ay hindi confident sa ginagawa natin. Also, napakahalaga rin yung sinabi ni Doc Lay kanina, yung kailangan ng dissemination din ng algorithms among yung mga ating mga public health managers natin mula sa ating regional offices hanggang sa ating mga municipalities at kahit nasa barangay. Okay, so napunta na tayo, Doc Lay and Doc Paul, doon sa ating local government units. So meron din tayong mga taga local government units na nanonood at nakikinig ngayon. So malinaw na kailangan ng ating mga bagong panganak at nagpapasusong mga kababaihan na hindi dapat sila mahiwalay sa kanilang mga anak mula sa facility hanggang sa kanilang mga community, sa bahay, sa komunidad. So bilang opisyal o bahagi ng local government, ano sa tingin ninyo ang kanilang papel naman para mapatuloy ang non-separation ngayong pandemic, lalo na sa pag-aayos ng kanilang mga quarantine or isolation protocols? I hope naging malinaw yung tanong po para sa inyo.
Mukhang para kay Lay yan.
Okay, si Doc Lay.
Sige, subukan ko po, nung ginagawa pa lang po yung isolation guidance, you were already very aware kung ano yung magiging impact nung talagang pipilitin natin yung mga tao na mag-mandatory isolation. Two-pronged siya. Kasi alam natin na may tendency din yung mga kababayan natin na baka naman gumala yan pagka sa bahay lang. No? Hindi ko matitiyak. On the other hand naman, parang kung sobrang tayo ay titignan natin na, hindi, lahat kayo dapat doon. Dapat kayo lahat doon. No? Ang laki pong burden yan sa local government ninyo. Tignan po ninyo kung kakayanin yung ituloy-tuloy yan. Lalo na pag nag-surge kayo. So baka naman, band-aid solution yun. Maka rin po tignan natin kung pwede natin i-explain na mas maigi yung importance nung options. Kaya po dun sa algorithm, kung titignan po ninyo, this is also aligned with the joint administrative order po na nauna mang na i-release, which is the community-based management of COVID-19. We can also provide that. The idea here is titimbangin natin kada pasyente. Nandun po yun na-discuss ko kung bang ang pasyenteng na ito ay maaring sa bahay or required na nandun sa isolation facility. Ang isang mahalagang konsiderasyon po dyan is for persons with limited or they require assistance for activities of daily living. Nandun po yan sa algorithm. So, ano yung mga yon? Nandyan po yung matatanda, di ba? Yung mga hindi pa gusto sa pag-iisip, yung mga bata, di ba? 4-year-old, paano mo yan ilalagay sa isolation facility? Hindi lang po yan sa breastfeeding mothers, no? And we have been hearing a lot of cries for help. As kayo po, MHO, ilagay nyo lang po yung sarili nyo sa posisyon nila, no? Some LGUs will do, they have their own separate facility for that, no? And yun po, babalikan natin ngayon, ano ba yung special consideration na yun for these dyads, mothers and babies? Going back, they are a unit. Unit po sila. So kung ang nanay, pipiliin niya na kasama niya yung nanay niya at talagang mag-isolation facility siya, kaya yun po, that's patient-centered choice. And how do you accommodate this? Ang isang tanong din po dyan, mahahawa siya doktor, yung baby mahahawa sa ibang pasyente. So that's something po that we need to also consider and prepare. Siguro, hirap sagutin ng tanong kasi iba-iba tayo ng konteksto. Pero I think bottom line concept, if the mother and the baby chooses to remain together, then at all times, they should be enabled. Unnecessary po yung separation kung ipipilit po na maghiwalay sila. Over.
Nakamute ako. Okay. So talagang mahalaga pa rin talaga na kailangan well-informed ang ating mga pamilya sa ating mga komunidad at na meron silang mga option na maaari nilang gawin para mapanatili na safe ang kanilang pamilya laban sa COVID-19 o kahit saan pa man sakit. At kung pipiliin nga, kung gagawa na ng choice yung nanay na gusto niyang sila lang hindi sila maghihiwalay ng kanyang anak, kailangan i-encourage ito ng LGU at lalo pang palawigin yung practice na ito para maging example na rin sila para sa the rest ng community. Okay, so punta na tayo dun sa Q&A mula sa ating mga kasamahan ngayong araw na ito. So unang-una nating tanong mula kay Miss Melody Joy Decal. Blessed Thursday po sa mga doktor natin at sa rest ng team. So during our vaccination last week, the doctor in charge for assessment told us that exclusive breastfeeding puts our baby in high risk of getting anemia kasi hindi po enough ang iron supply ng mother to compensate the baby's need. With this information, she recommended mixed feeding, which I strongly disagree with. Is there any basis for this? Doc Lay, kung okay lang, ibigay ko na to kay Doc Paul na question kasi kanina diniscuss niya yung ating hierarchy of feeding parang na kailangang masunod pa rin ngayong pandemya. Doc Paul?
Itatanong ko dapat kung yung question na to nasa context ng COVID-19 or general question, but the answer is the same for both. No? Ano ba yung basis natin for recommending 6 months exclusive breastfeeding? It's because on the nutrition side of things, it provides the full requirement of a child in the first 6 months of life. Full requirement, no? Wala pong sinasabing deficient in this, deficient in that. Full requirement, kahit na water, di ba? It's in breast milk. So, wala po tayong di po tayo concerned with iron deficiency in that age group. We are more concerned with the risk of mixed feeding or the risk of not exclusively breastfeeding. Kasi pag hindi ka nag-exclusively breastfeed, ang dami mong nawi-withhold na benefits from the child that could cause more harm than yung mga sinasabi na pwedeng anemia or nutritional deficiency. So yung withdrawal of the skin-to-skin contact, yung withdrawal of the psychological benefit to mother and child of the act of breastfeeding, the health and nutrition benefits of mother's milk at that 6-month period, lahat yun ibabawasan mo. And then when we do mixed feeding, di syempre magpapasok ka ng formula, and then we know na merong risk associated with that. Yung formula is not a sterile product. There's the risk na hindi siya ma-constitute na maayos. There's the risk na depende sa setting, na hindi malinis yung gamit na gagamitin. So again, yung pagtinimbang mo yung dalawa, babalik ka pa rin sa main recommendation that breast milk in the first 6 months of life provides the full nutritional requirement for children. There is no need to supplement or to even mix. So I would go back to the doctor who suggested that and let them justify why their recommendation is different from what the World Health Organization and all the societies are recommending.
Okay. Yes, go ahead, Dr. Len.
Maybe just to add dun kay Dr. Paul, kasi Dr. Paul already discussed dun sa breastfeeding option na siguro for kumpiyansa din para sa health workers natin. Kaya pa rin natin sinasabi yung properly timed cord clamping. Kasi, di ba, alam naman natin sa unang yakap, transfusion yun eh. Transfusion yun ng dugo. Kung pinutol natin agad yung puso, dati nagkaroon ng gano'n, yung pinuputol ka agad kasi baka daw mahawa yung baby sa nanay, no? Yung 1 to 3 minutes na yun, na hinayaan po natin na before pulsations, yung pagputol na yon, lilipat pa ho yung dugo na galing sa inunan papunta sa baby. So that also provides the reserve for iron that will sustain the baby. Over.
Okay, so basically yung sagot ay walang basis yung naging recommendation ng ating health worker, and minsan talagang meron pa talaga tayong mga kailangang additional na education na kailangan i-impart din sa ating mga colleagues na nagbibigay rin ng serbisyo sa ating mga komunidad. Okay, so next is mula kay Rick Manuel. In this pandemic, the number of premature labor increases while the number of available incubator decreases. How can we help this situation using the algorithm?
Mukhang sa akin yun, Paul. So, ang tanong is, dumadami yung
ating mga premature labor, yung ating mga premature birth, pero kumakaunti ang incubator natin para ma-accommodate sila.
Oo. Ang ganda po nung tanong kasi it brings the question on sino ba dapat yung gumagamit ng incubator? Diba? So all the babies by default right now should be together with their mother. So dapat, kung ideal world, walang dapat nandun sa incubator na yon. Diba? Pero paano kung preterm? Another thing, not all preterm babies need to be in the incubator. So ilang percent? I think mga 1% or so yung mga magiging complicated na deliveries. So we want to prevent the babies from even coming to the incubator. And the way to do this really is unang yakap po. Kaya babalik pa rin natin dun sa prevention. Kasi po, by the time na kinulang na tayo ng bed sa incubator, wala na po tayong magagawa dyan at hindi po namin kayo matutulungan. Sorry po, ganun talaga siya. We want to prevent kung sino lang dapat yung nandun, yun lang dapat yung nasa incubator. Over.
Okay, maraming salamat po. At by the way, kasama rin po pala natin si Dr. Maria Asuncion Silvestre ng Kalusugan ng Mag-ina, who is also part of HPAC. Tumutulong na rin po siya sa pagsagot. And we are very fortunate that she would be happy to also answer the questions sa ating Q&A panel. So good morning po, Doc Mian. Ngayon, para sa ating last question, because we're running out of time, ito ay mula kay Dr. Maria Julita San Joaquin Sibayan. Ano po ang pwede namin gawin sa mga pagkakataon na nakakakita kami ng mga inconsistencies sa implementation, kagaya ng hindi pagpayag sa vaccination ng mga buntis o nagpapasusong ina? Malimit kasing healthcare professionals din sa LGU ang nagsasabi ng taliwas sa ating guidelines at algorithm. Either Doc Leipo or Doc Paul Mari pong sumagot.
Would you like to take a first
sige,
stab?
you can start and then
Yeah, sige. Nakakahiyaan pa kami ni Dr. Foy. Si March, hello Doc March. So ang question po ni Dr. March ay, anong gagawin kung taliwas sa guidelines, halimbawa sa vaccination, yung mga local government, no? Siguro babalik ko pa rin po, maybe Dr. March, if I may contextualize, you're a private practitioner, no? And we are really, we are seeing this across the country, variability, no? In practices, in a way parang expected siya, but we want to minimize this. So what to do kung ganito, no? Babalik po yan dun sa polisiya. Okay? Kung merong polisiya na nandyan, kuhanin po na yan. Pakita niyo po siya. Ang hirap kasi kung ang pinanggagalingan nung demand is wala po sa posisyon to implement it. Pero bilang advocates, what you can do is to get the policies and try to have a dialogue with the MHO. Alam ko medyo mahirap to, or kung sino man po, local health board, kung sino man po yung pwedeng daanan. Aside from this, no, halimbawa, I know a doctor na kasi hinihingan daw sa LGU ng certificate yung kanyang pasyente na certification na may sakit, ganun. Ang ginagawa ng doktor na kakilala ko, pinapadala niya yung policy na hindi kailangan. So ganun po yung binibigay ng mga pasyente. Over.
Oh, so okay. So okay na po kayo, Doc Paul. Okay. Sige po. So maraming salamat po, Dr. Alfonso at saka Dr. Zambrano. And bago po tayo magsimulang magsara ng ating session para ngayon, kailangan lang nating i-remind yung ating mga sarili na ang kumpiyansa sa algorithms ay napakahalaga para magkaroon din tayo ng sariling kumpiyansa para makapag-deliver tayo ng maayos na serbisyo para sa ating mga nanay at mga babies, lalo na tayo ay taga-health facilities natin, pati sa ating mga local government units. Iisa lang ang layon natin na mabigyan sila ng tamang pangangalaga ngayong pandemya, lalo na isa sila sa mga pinaka-vulnerable na mga miyembro ng ating komunidad. So again, napaka-importante rin ng dissemination ng ating mga kaalaman, yung mga mula sa mga public forums na ito hanggang sa pagbabasa ng mga policies na nagiging available sa atin mula sa DOH website, yung sa mga social media ng ating mga government agencies. Ito ay napakahalaga rin. At laging maging aware sa mga polisiya dahil ito lamang talaga ito yung isa sa mga pinakamagagandang pang-correct sa ating mga kamalian na nakikita sa LGUs. Bawat isa sa atin ay instrumento ng tamang pagdi-disseminate ng mga polisiya na ito at makakaasa kayo na katulong natin palagi ang ating mga Centers for Health Development at para naman sa BARM at nandito rin po ang Ministry of Health ng Bangsamoro Autonomous Region of Muslim Mindanao. So closing statement na lang po, mauna po muna si Dr. Zambrano and then si Dr. Alfonso. Ano po yung mga pinaka-takeaway na gusto ninyong matandaan madala ng ating mga kasamahan sa session na ito? Mauna po muna kayo, Dr. Zambrano.
Hindi ako ready sa closing statement. Pero siguro ang galing nung nagsasama-sama lahat ng evidence at experience natin at napavalidate kung ano yung practice natin even before nag-start yung pandemic, which is unang yakap, exclusive breastfeeding, and breastfeeding counsel support, non-separation. So lahat po ng recommendations doon patuloy pa rin. In fact, mas lalo pa natin silang dapat gawin dahil may COVID-19 imbis na questionin natin kung bakit natin siya ginagawa dahil mayroong COVID-19. Yung protection po na binibigay ng mga practice na to in the short term, pati long term sa buhay ng nanay at ng bagong panganak na sanggol, patuloy pa yan at lalo lang po na-emphasize dahil meron po tayong pandemic. So, balik po tayo sa kumpiyansa at siguro dagdagan po natin ng konting pasensya. Pasensya po sa ating mga nanay kung di po nila niintindihan lahat ng basehan sa ating recommendation. Pasensya sa ating kapwa health workers kung hindi po lahat tayo minsan nagkakaintindihan. So, nandito po yung DOH at kami po mga partner anytime you need help sa mga intindihin yung mga information. So, maraming salamat sa DOH at sa HPAC. Over.
Maraming salamat po, Dr. Zambrano and Dr. Alfonso.
Thank you, Dr. Poy, for that. Ang ganda ng sinabi ni Dr. Poy, kumpiyansa at pasensya. No? Lahat po tayo nagkagulo talaga nung umpisa. And this is a learning process for all of us. I echo him. Ito ay binavalidate ng mga bagong ebidensya yung matagal na nating ginagawa. And sana po, dun sa discussion natin ngayon, nakita nyo kung gaano kabusisi ang ginawang proseso para come up tong guidance na to. Hindi siya hinugot sa hangin. Dr. Poy already said that also. So hindi siya hinugot sa hangin, and hope you can download and use them, not just for maternal and child health, but also for return to work clearance, for screening your patients in COVID. And sana po makatulong po sa inyo. For any feedback, you can comment po doon sa page ng Piecemeal. Ingat po tayong lahat.
Maraming salamat po, Dr. Alfonso and Dr. Zambrano. At nagpapasalamat po kami na nabigyan niyo kami ng oras ngayong araw na ito para ma-share ang inyong mga kaalaman pagdating sa sistema ng service delivery na kailangan nating i-adopt. Yung mga policies at standards na kailangan nating i-adopt para makapagbigay tayo ng mas magandang serbisyo para sa mga pamilyang Pilipino. Okay, maraming salamat din sa ating mga nakikinig ngayon at sa ating pagsasara. Sana po ay na-realize natin na napaka-necessary ng discussion na ito to improve health service delivery during these times, as a lot of clarification is needed in supporting our mothers and children in taking care of their health during this pandemic. And so to close this session, we have with us Dr. Leonila F. Dance, one of the conveners of the Healthcare Professionals Alliance Against COVID-19. Dr. Inday Dance, or Professor Dance, is a pediatrician, and she is quite a decorated public health expert and practitioner. Dr. Inday Dance is also a professor at the University of the Philippines at the Department of Pediatrics and Department of Clinical Epidemiology. She is the pioneer in pediatric rheumatology in the Philippines, and she started the fellowship in pediatric rheumatology at the Philippine General Hospital. She also received her master's degree in clinical epidemiology in 1991 at McMaster University in Ontario, Canada. So please welcome Professor Inday Dance. Dr. Dance, thank you for joining us today, ma'am.
Magandang umaga pa. Pero hindi ko mabuksan yung yung aking video. Pero sige, okay lang. So, hindi ang aking picture. Pero, yan. Natutuwa ako at naimbitahan ako maging closing speaker ngayong session na ito. Ang excited ako kasi ang daming nagsama-sama, katulad na rin yung aming grupo, yung Health Professionals Alliance Against COVID, pati yung Department of Health at marami pang mga kasamahan natin dito sa topic na ito, no, para sa session na ito. Sa akin, sarili, yung pinaka-special, ang pinag-uusapan dito yung breastfeeding at saka yung isa pa yung evidence-based medicine. Itong dalawang topic na to very special sa puso ko. Bira akong magyabang sa mga ganitong conference, pero ang pinagyayabang ko lagi sa breastfeeding is I was able to breastfeed yung 3 kong anak. Kasi alam ko how hard it is and how important is the support group sa ganitong mga okasyon sa ating buhay, yung breastfeeding. And kaya naging successful ako dahil na rin sa mga sumusuporta. At alam ko yung nasa grupo na ito, marami sa inyo ang tumutulong sa mga nanay na maging successful sa breastfeeding. Nung dumating ang isa pang favorite topic ko or field yung evidence-based medicine. And why am I talking about this? Kasi nung dumating itong pandemya na to, parang hindi ko na-realize na ito yung mga tinuturo namin, no, yung evidence-based medicine ay magiging napakalaking tulong sa pag-responda natin dito sa ating malaging krisis na ito. So dito sa topic na breastfeeding, no, sa maternal and child care during this pandemic, malaking role yung naging very important sa pagbuo ng ating mga polisiya. Maraming nag-aakusa na sa atin na, ay naku, nakalimutan, parang biglang nakalimutan yung mga prinsipyo na ginagamit natin sa paggamit ng evidence-based medicine sa medisina. Sabi nila, hindi raw natin pinag-aaralan. Pero balik kung ako ay kami yung mga nag-umpisa or project leader nung Living CPG, paulit-ulit na minention ito ni Dr. Lay, nakasama nga itong algorithm na to sa ating nursing mothers at sa ating mga bagong panganak. Doon ko nakita na ang importansya ng paggamit ng evidence sa ating mga decision making. So, tama yung sabi ni Dr. Lay, yung Living CPG, kaya living yun kasi alam natin na napakadaming ebidensya kasi 2019 December nag-umpisa tong COVID, pero parang buo nung 2020 hanggang ngayon napakaraming ebidensyang lumalabas. So yung ginagawa namin sa Living CPG, kasama na rin itong maternal and child health care, is parangisummarize ito, pagsamasamahin at ibigay ito sa ating mga policy makers. So yung sinasabi ni Dr. Lay na pinaghirapan, ako ang ebidensya nila na talagang ilang gabi nila talagang pinaghirapan ang mga algorithms na to, lalo na dito sa ating maternal and child care. At hindi lamang mga polisiya galing sa World Health Organization, sa ating Department of Health, pero talagang marami silang kinonsulta para mag-ugma-ugma, para tumama at mailagay nila dun sa simpleng algorithm na yon. Tama siya, sa umpisa parang nakakalula, pero pag tinignan ninyo at natutunan na natin gamitin, makikita nyo na parang simple lang siya. Nandun na, parang pinagsama-sama na nila at dapat walang magkakaiba sa ating mga recommendation. So isa yun sa magandang nangyari sa paggawa nila ng algorithm. So bago ako magtapos, may dalawa akong dapat na paalala sa grupo na to. Sa paggamit ng ganitong mga klaseng practice guidelines, clinical practice guidelines and algorithms, may dalawa lang akong paalala. Una, ang importanteng titingnan nyo yung petsa. No? Petsa kung kailan nila nilabas yung guidelines. Kasi napakabilis ng pangyayari, napakadami ng ebidensyang lumalabas na we need to update it lagi. So kaya tinatawag naming living buhay kasi hindi yung pag ginawa mo ngayon tapos na. So pag may titingnan kayong dokumento, may titingnan kayong polisiya, actually ginagamit nga nila sa social media, luluma na no nung mga iba para maloko yung iba o malinlang sila, no. Importanteng i-check niyo yung date. So importante yan, petsa, kung ano yung binabasa niyong dokumento. Yun ba yung pinaka-latest, no? At saka yung number 2 na gusto kong i-share, ang mga clinical practice guidelines are just guidelines. Pero ang maganda dito, di ba, parang iba-iba, may variation sa mga ginagamit nating, may mga isang nagsabi diyan, kakaiba yung sinabi ng isang doktor, kakaiba yung sinabi ng LGU. So ang importante, alam ninyo yung dokumentong ipapakita natin. Maganda sana kung alam natin talaga ebidensya, pero minsan hindi na natin masaulo yun o hindi na natin maalala. Pero kung may guidelines kang pinaghahawakan, katulad nito, pwede natin ituro lamang itong pinagsama-sama na unified algorithm na ito, mas madali tayo makakarason. And importante yung gamitin din natin sa pakikipag-usap sa ating mga pasyente, sa ating mga magulang, sa ating mga nanay. Kasi yung bottom line naman talaga dyan, magdi-decide din naman sila. Everything has to be individualized. Pero at least meron na tayong gamit para matulungan ang kanilang desisyon kung sasama ba nila yung anak nila kasi or hindi. So kung maipapaliwanag natin to ng maigi, dahil alam natin yung ebidensya, alam natin yung polisiya, alam natin yung guidelines, mas matutulungan natin yung mga magulang na mag-decide kung ano ang mga dapat nilang gawin para sa kanilang mga pamilya at sa kanilang mga anak. So yun lang. And then, bago pala ako mag-end, ang gusto kong sabihin sa lahat, gusto kong magpasalamat sa lahat ng nandito sa grupo na to. Alam ko kasi na sobrang hirap ang ating hinaharap dahil maraming mga kumukontra, maraming mga humahadlang, yung iba naman may mga may mali siya sa mga ginagawa. So kaharap din natin yan. So marami tayong mga obstacles na kailangang harapin at bigyan ng solusyon. At alam ko tong grupo na to, maraming hinaharap na ganon. So gusto kong magpasalamat sa inyo at nandyan pa rin kayo at tumutulon. Sinasabi ko nga lagi halos sa lahat ng aking mga pagsasalita, ang lahat naman ito para sa bayan. So hashtag para sa bayan. So maraming salamat. Yan lang.
Maraming salamat po, Professor Dance. Doc Inday, maraming salamat po sa inyong napakagandang mensahe. Professor Dance, pasensya na po. Pwede niyo na pong buksan ng inyong webcam.
Ito ako.
Pasensya
Alive. Hindi to tape, hindi to recorded.
Good morning po. And para po kay Dr. Zambrano, maaari niyo rin buksan yung ating video para makita tayong lahat ng ating mga participants. So yung mensahe nga po, bago tayo magtapos, yung napakahalagang mensahe po ni Dr. Dance, yung petsa ng guidelines, kailangang alamin dahil ito ay patuloy na ina-update para lalo tayong makatulong sa mga pamilyang Pilipino. At alamin yung laman ng dokumento at yung kumpiyansa rin sa dokumento dahil ginagabayan ito ng ebidensya itong mga guidelines na ito para mas lalo tayong maging mabuti sa ating serbisyo, na ginagampan ng serbisyo para sa ating mga kababayan. At muli, maraming salamat sa World Health Organization, sa United Nations Children's Fund Philippine Country Office, lalong-lalo na sa Healthcare Professionals Alliance Against COVID-19 o ang HPAC, ang Kalusugan ng Mag-ina, ang Alive and Thrive, ang National Nutrition Council, ang ating mga Centers for Health Development at ang Ministry of Health ng Bangsamoro Autonomous Region of Muslim Mindanao. Sa lahat ng mga local government units natin na nandito, maraming salamat po sa inyong pagsuporta at pagdalo sa ating mga sessions. Ito na po ang ating pinakahuling technical sessions, pero mas marami pa sanang sumunod at sana ay sumali pa rin po kayo. Sa ating mga health workers, maraming salamat po sa pagdalo at pagbibigay ng inyong oras. Alam natin na napaka-trying nitong mga panahon na ito at maraming salamat din po sa inyong pagsuporta dito sa ating National Breastfeeding Awareness Month. At paalala ko lang po, meron pa po kaming isang event pala at ito na po yung pinakahuli naming event para sa na technical na session din po, pero para naman po ito sa pamilyang Pilipino. Makakasama natin ang ating mga mother support groups at ilang mga eksperto na magsasabi sa atin kung gaano kahalaga ang pagkakaroon ng suporta sa labas ng ating mga health facilities, lalong-lalo na sa loob ng ating mga komunidad. Ito po yung, at kung sakaling gipitin, magpatulong at kumonsulta. Nandito po sa ating screen ngayon ang registration link at ang schedule. Ito po ay sa Sunday, August 22, 10 o'clock a.m. hanggang 11:30 a.m. Nasa chat box din po ang ating evaluation form para makakuha po kayo ng Certificate of Participation. At muli, mula sa aming lahat sa Department of Health, maraming salamat po sa pagpunta ninyo at pagdalo sa lahat ng ating mga technical sessions. Nawa ay maging instrumento po tayo ng tamang impormasyon at gabay para sa ating pamilyang Pilipino. Maraming salamat po.
Hello there mga mommy, let's go for healthy pregnancy. Tamang pagkain ng dapat para malusog kayo ni baby. Remember mga nanay, breastfeeding malaking bagay. Ito'y ipagpatuloy kahit na over 2 years old. Tamang nutrisyon, don't forget, yan ang tamang solusyon. I like it, lucky one, oh, oh, oh. Yan ang tamang paraan, tamang solusyon. boy, sustansya'y dapat puno. Susi sa tamang paglaki, go grow food na handa mo. First 1,000 days, importante, healthy eating para kampante. Paghandaan nutrition ni baby, makinig sa sinasabi. Tamang nutrisyon, yan ang tamang solusyon. I like it, laking one, oh, 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 yan ang tamang paraan. Tamang nutrisyon, yan ang tamang solusyon. I like it, laking one, oh, 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 yan ang tamang paraan. Laking one, oh, 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 yan ang tamang paraan.
Nasa tiyan mo pa lang ako, alagang-alaga mo na ako. Kung ano ang kinakain mo, yun din ang kinakain ko. Mga nanay, kain kayo ng mabuti ah.